So as case counts continue to mount, and in some cases we're seeing grow, Pence, for the vice president, has come out and said that they're looking at phasing out the White House virus task force that we had all gotten pretty used to. Rick Newman has been looking at that and also this patchwork of reopening and what it means for coronavirus cases and, in the end, possible death toll. So, Rick, first of all, why get rid of the virus task force?
I don't know. It almost sounds as if the Trump administration is trying to make the point that we don't really need it anymore. We're turning the corner. That has been the narrative. Of course, Trump keeps saying we're going to be coming back really strong anytime soon. A lot of economists doubt that. But this task force, the thing headed by Mike Pence, it includes Dr. Fauci, Dr. Birx. It's the reason they've been having those 5 or 5:30 p.m. briefings every day to update everybody on whatever the task force did. And they are overseeing policy on the virus for the government. So it almost sounds as if they're saying by the end of May, we're not really going to need this anymore. And I think it's important to point out that what seems to be happening here, Jen, is we are as a nation are not choosing the path of lowest deaths. We seem to be at some level prioritizing reopening over minimizing the number of deaths. And I don't know what exactly the right approach is here. But, you know, the rate of infection and deaths and hospitalizations is only going down in about 3 states. And that's the New York tri-state area, New York, New Jersey, and Connecticut. It is either staying where it is or even going up in many other states. And these are a lot of states that are reopening anyway: Texas, Florida, Georgia, Tennessee, a bunch of others. So as we're trying to figure out what's the right balance between public health and reopening some businesses, we seem to be saying as a country that we are willing to tolerate a higher toll on public health in order to get some of these businesses open.
And this was kind of framed as a coast versus the rest of the country. I mean, you note the New York numbers. California actually did have some okay stuff coming out earlier with their first drop in weekly deaths. But LA, you know, there's been some issues in there. So where do you put California in all of this? Because Gavin Newsom has been pretty strong, but the numbers aren't right now where they are for the tri-state area.
Yeah, they have relatively good numbers, especially compared with New York. But that is under a strict regimen of lockdowns. So they have what you might call the highest or most severe level of lockdowns at this point. And Gavin Newsom is talking about easing up on some of that. And, we don't exactly know what's going to happen, but the forecasters, which includes people looking at both the epidemiology and then also the economic impacts, are saying it's just a kind of a matter of math and science that we are going to get more infections, more hospitalizations, and more deaths as we ease up on these restrictions. And the University of Washington, which is producing one of the forecasts that most people are paying attention to, recently raised its forecast for deaths in the United States by August from around 70,000 to around 134,000. That's a big jump. And the reason they made that change is because they say we have to factor in the loosening of all these guidelines and people starting to move around a little bit more. So this might tell us all this is how we're going to get through it. We are going to have a fairly high public health toll and try to just plow through that.
Wow. Okay. Rick Newman evaluating some of the decisions that are being made around the country here.